right. We are back on Facebook Live. Sorry, I'm switching this thing around, trying to make sure it's level. I'm switching it up from my, so I'm switching up these Facebook Live sessions. I used to do them, I was doing them on the Fuel page. I'm still going to post them to the Fuel page, but because of Facebook and their algorithm and everything like that, I'm going to be doing them from my personal page. So that way more of you can tune in, see me, ask questions. It just makes it a lot easier. So, hey, Jeff, how's it going? Good to see you. Hey, Dave, Kittle, good to see you. How's it going? Thanks for tuning in. Hey, Nick, thanks for tuning in. So today what we're going to be going over is some back pain that I've been dealing with myself and what I'm doing about it and how I'm going about treating it. So I know a lot of you, hey, Dave, hope Florida's still warm if you're still down there. Jealous that you are down there. So one thing that that you guys might be thinking as far as, oh, Eric's a physical therapist. He probably never gets hurt and never gets back pain or anything like that. Hey, Stephanie, thanks for tuning in. So as you guys, you probably know, I'm human just like anyone else, and so is any other physical therapist. And guess what? We get hurt too, and we get injured. So I've been dealing with my own fair share of injuries here this past year. So between getting a stress fracture in my foot while training for a marathon, had a good plan, but hey, things happen. And then now I've been dealing with some back issues. It goes from my back. It's kind of follows a little bit of a sciatica, but it's not a true sciatica, going down into my butt and can go down the leg a little bit. So if you are dealing with symptoms like that, if you get back pain that's going down your leg, or you have, what you call sciatica, or someone else said you have sciatica, you want to listen to this, because I think that what I have to say could really help you out. So this happened for me. It came on about a little over a month ago. I was doing a workout at CrossFit. My back had felt kind of stiff that day, and I decided that, I was still going to go through with the workout, and I was going to push through it. So I knew, okay, I might pay for this a little bit later. Little did I know I would still be dealing with it now. So the athlete in me and the competitor got a little bit ahead of myself and kind of took over from the physical therapist, healthcare professional. I kind of ignored that side of me. So I was doing some clean and jerks and essentially flared it up. And I've had some back pain before, but this is definitely a little different in the fact that it's how it's persisted. So with where I work in Allendale at NovaCare Rehabilitation, I had my coworker and physical therapist. I had him work on me a little bit, thinking that one kind of small manual treatment might solve it, or some home program that I could implement myself. He worked at it a couple times, but it helped. It helped, but after 2 times, it really didn't make a significant difference. So come to last week, I decided, hey, this thing's still going on. I want to get better. I'm going to have to sign up for some regular physical therapy, and not just necessarily when I want it, but, when I need it. So there's a big difference right there between want and need. So when people want something, it's, at their own will. So, hey, I want something now. It's convenient. I'm going to do it now. Versus, hey, I know it needs to get done. I know I need to get into the gym or whatever consistently. Then that's the difference between a want and a need. And that's why we, as physical therapists, develop a plan of care for our patients. It's not because of what the patient wants. It's because of what they need to do to get better. That is what I preach to my patients. If they're not coming and seeing me and they're not getting any results, we take a look and, hey, are you following the plan of care? Chances are, if you're not doing what I told you to do, then you're not going to get better. So that's a pill I had to swallow is that I need physical therapy regularly, so I'm going to be treated for that. So I had my coworker perform an evaluation today on me, and we started that. So feeling pretty good after having him work on me and then implementing. We both, since we're obviously both physical therapists, I told him what I've been doing for treatment. He had some different ideas as well that really helped. So shout out to Nick McBride for helping me out there. And so, yeah, we're definitely working as a team, which really isn't much different than how we work with normal patients. You know, we really work as a team with our patients to get them better. We have to listen to them, hear their input, what works, what doesn't work, to really develop that program that's going to help them get better and get to where they need to be and reach their goals. So, did you concur with the findings, Stephanie? As far as, what do you mean by concur with the findings? So as far as what my coworker found, yeah, I think as far as what he found versus what I was thinking. So originally, just so you guys know, I was thinking I possibly had a herniated disc that I re-aggravated. And really, after having him evaluate me, because it's hard to self-diagnose and self-treat, you know, I think it may be coming a little bit more. I've got a mixed bag of things going on. Definitely some mobility issues in the spine, as well as some trigger points that are referring pain elsewhere. So, Stephanie, you'd like this. So we did some dry needling to the glute med, did some multifidi as well, and glute med definitely felt that referral pain to the low back. So, I think the dry needling, I think that's going to be one component that helps reduce the symptoms, as well as hitting some of those weak spots where I really need to work, some hip mobility that needs to be worked on and implemented, as well as some hip strengthening for some glute med and neuromuscular control. So, hey, Kristen Hayer, thanks for watching. Yeah, absolutely, Stephanie. Collaboration is the key. And that's what I really find with my patients that I get better. And Stephanie, I know you know this too. Where communication is best, I know that is where we get our best results. So collaborating with the patient, the physician, if they're referred by a physician, and even the other healthcare providers or wellness providers, if you want to throw personal trainers into the bag, chiropractor, RD, you know, dietitian. I think all of that collaboration definitely is key. I think, Stephanie, you nailed it right on the head there. If we're going to get people better, we really need to make sure everyone's on the same page with this person, and we're not missing some big key thing that one person's doing and we don't know about, and vice versa. You know, we're doing something that they don't know about, or, hey, they don't even know that they're in physical therapy. So, for example, like personal trainer, for example, they're still going to see like a personal trainer because you didn't talk to them and say, hey, oh, you're working with a personal trainer at the gym. You just dove right into it and tried to solve the problem. And then the personal trainer is doing things that you might not agree with. That communication is absolutely key in collaborating and finding a solution. So the other thing too that I wanted to hit on and talk with you guys is New Year's is here. Well, it's over. Spring break is coming up. You probably felt the need to get into the gym quick, to lose a couple extra lbs so that you're spring break ready if you're going down south. That's, you know, nothing new there. However, recent patient, hey Nick, how's it going? Tell your wife I said hi. Thanks again for helping me out here today. Did you loop it with the nerve root segment with the dry needling of the muscles involved? You know, Stephanie, honestly, I did not loop it with the nerve root segment of the muscles involved. However, should have definitely done that. Definitely should have hit both of those. However, I kind of wanted to see how simply hitting glute med today felt. The multifidi that we did were back, that was last week, and I definitely felt it more, the referral pain with the glute med today. Should have hit hit the nerve root segments as well, but didn't do that. Definitely will be doing that though the next time I do dry needling, because I'm a proponent of there's a time and a place for it, and when it works, it definitely works. Yeah, thank you for that. Thank you for those ideas. Going back to kind of hitting the gym and everything. So just saw my first patient today who is kind of the she had all the right intentions of getting healthy, going to the gym, getting ready for spring break. Too fast, too quick. So going from 0 to 100, she went from not, working out every now and then, not really consistent, to 10 days in a row, going 90-minute sessions. Looking like she's got an inguinal hernia now that she's dealing with. So if you are getting into the gym and you have not been into the gym in, a couple months, couple years, do not start off that hard. It takes time for your body to adapt. You need to come up with a good plan of care. So consult with a healthcare professional. If you've got issues, you need to talk with your physician beforehand. It's a good idea to talk to a physical therapist too, especially if you've been dealing with any prior injuries before you get into working out hard. Find out what's appropriate, what's not. And also, it's not a bad idea. Get with a good personal trainer that has a good certification. For those of you who don't know, the CSCS certification, so that's a Certified Strength and Conditioning Specialist from the NSCA, or some other ones. You can look them up online as far as credentials. I think the CSCS is one of the better ones to have. It's one that I have personally, so just to throw that out there. And it's not an easy test to go through. Definitely shows that they took the time to pass a test that is credentialed. So those are good people to work with to make sure that you're being safe about it. So don't go at it too hard. Don't feel like you need to go every day of the week. That can definitely be counterintuitive. Yeah, and Stephanie, absolutely. I agree with that thought, though, as far as hitting the nerve roots. You don't always have to hit the nerve roots as well, but it's definitely not a bad idea. Sometimes starting small, that was kind of my thought today, as far as let's hit this one muscle. Let's see how involved the gluteus medius, versus hitting everything and then kind of guessing, okay, what was it that did it? Because sometimes I know I can kind of like, man, I could hit this, and this, and have 8 different things that, you could dry needle, but which one really made the difference? I think, yeah, like you said, sometimes starting small is good. Definitely having a good plan of care, though, and not going in blind is absolutely important. Or I shouldn't say going in blind, but going in with, I'm just going to treat the whole body and dry needle the whole body. You're going to be pretty sore after that. That's for sure. If you're if you're doing that. So that's the same thing with all of our treatments too. You need to have a good course of action that's specific and meets the individual's impairments and needs. And every patient is going to be different. That's for sure. So, yeah. So thanks everyone for watching. If you have any comments, please comment, shoot them below, or any suggestions. So all my PT friends out there, if you have anything you want me to try or document, if you want me to throw some dry needling onto a Facebook Live session one time, I have no problem doing that, and would be happy to do that to show you what that's all about. If you're looking at taking a course, so Nick, I know you're looking at wanting a course. Stephanie's awesome. I know she's teaching at Kineticore, at least I believe you still are, Stephanie. So I've been a proponent and trying to send people your way to take those courses. We had, with our course, they brought it in through a different company than Kineticore. They did a good job, but I've heard nothing but awesome things about Kineticore and those courses as well. And again, it's a time and a place for everything. Not everyone is meant to be dry needled, by no means. There is research that still needs to be done on dry needling. It's definitely not perfect. It's just one way that I'm taking my back pain into consideration and treatment. And so the moral of the story is, if you're dealing with something too, and it has been over 2 weeks and you're not getting improvements, get in and get seen today. Get it taken care of. Don't wait. It's what you need. It's not what you want. Okay. If you wanted it to be gone, it would already be gone. So get in, get it fixed, and come up with a specific plan of care that's going to meet your needs. So that way you're not facing some sort of consequences down the road, and it's much harder to treat and deal with. I'll tell you that chronic pain can be a lot more difficult to deal with than an acute onset of pain or an injury. So something to think about there. Thanks so much, Stephanie. I appreciate your input. And yeah, absolutely. Collaboration is key. So thanks so much for watching, everyone. Hope you guys have a great Monday. Hope you guys look forward to the rest of your week and have some good big plans planned out. So enjoy. Shoot me any messages or comments with any questions you have, any comments, concerns, and I will talk to you guys later. Bye.